Imagine your friend Ted, who craves external admiration to protect his fragile self esteem. His fear of failure and need for approval drive his motivation, but emotional volatility and impulsivity often lead to self sabotage and maladaptive behaviors. Ted exemplifies an individual with vulnerable dark triad personality traits, which is represented in this image. So, how does the VDT relate to motivation and emotion? Here are the focus questions we will explore through this presentation. The VDT contains three malevolent and callously manipulative personality traits. Vulnerable narcissism is marked by hypersensitivity to criticism, feelings of inadequacy, and a need for validation. Secondary psychopathy is characterized by impulsivity, emotional instability, and reactive behaviors. Borderline personality manifests through rapid mood swings, emotional volatility, and difficulty regulating emotions. For individuals with VDT traits, motivation is tied to their insecurity and avoidance behaviors, which stems from a desire for self protection against emotional pain and social rejection. Avoidance motivation and performance avoidant goals are prominent because of their fear of failure, rejection, and criticism. This is consistent with the expectancy theory of motivation, where individuals focus on avoiding failure rather than pursuing success. VDT individuals also seek external rewards and validation to compensate for their fragile self esteem and to avoid emotional distress. VDT individuals experience heightened emotional reactivity marked by impulsivity and sensitivity to criticism, rejection, and other negative feelings which threaten their self esteem. This emotional instability leads to persistent negative effects such as anxiety, irritability, and shame, which impairs their motivation and goal directed behavior. Emotional defensiveness, such as passive aggression or withdrawal, is used to protect their fragile ego and avoid emotional pain. These emotional patterns prevent emotional growth and reinforce maladaptive behaviors, making it difficult to cope with emotional challenges. As VDT traits involve emotional instability, insecurity, and maladaptive coping strategies, psychological intervention should include a client specific approach focusing on emotional regulation, enhancing self esteem, and addressing maladaptive thought patterns. Research shows cognitive behavioral therapy is effective and can target these motivational and emotional deficits, helping VDT individuals to develop healthier coping strategies. In conclusion, motivation and emotion are deeply entwined within the VDT traits. These traits foster avoidance-based motivational strategies driven by insecurity and a desire to protect themselves from failure, rejection, and criticism. Emotional instability leads to maladaptive behaviors, often as self-protective mechanisms. VDT individuals also tend to react defensively and impulsively, which can hinder personal growth and reinforce negative behaviors. Psychological interventions like CBT can help individuals build self esteem and reframe maladaptive thought patterns to help develop healthier ways to manage their emotions and motivations.